Okay, so last but not least, the last two slides, the treatment approach. The most paramount thing for this group, because they have a history of being frustrated with not being diagnosed with all their somatic symptoms with something to their satisfaction, a medical diagnosis, is to not start off with thought challenging, but rather ensure and foster a therapeutic alliance. You want to validate them at first, and you can get into thought challenging and other interventions such as that at a later point. But first, you first and foremost need to develop a good relationship with clients like this. They often have childhood trauma. You can do brief psychodynamic theory, typically 1 to 2 sessions. You can explore any unresolved childhood traumas or issues that might be contributing to their symptoms. And CBT and ACBT can focus on looking at thoughts, feelings, and behaviors, how they tie in. And the ACBT focuses a little bit more on emotion than traditional CBT. Psychopharmacology for this group typically involves SSRIs, antidepressants. They often have co-occurring anxiety. So that would definitely require consideration and a referral to a psychiatrist or a medical doctor for pharmacology. And then I recommended weekly individual and group counseling for this client, and depending on whether he stayed out of prison or not would dictate whether it be inpatient or outpatient. So I think in my paper I put that he was trying to make his life better, and if granted parole, he wanted to follow through with counseling, and he was attending church weekly, and he's going to be a most upstanding citizen in the near future. And the final slide is the aims, objectives, and interventions slide. I have Terry will learn and recognize how his thoughts can potentially affect his physical symptoms. Terry will keep a daily journal to identify somatic complaints and any perceived co-occurring emotions, triggers, links he can identify. Terry will use alternative learned positive coping skills such as distress tolerance, self-soothing, and deep breathing exercises 80% of the time physical symptoms manifest. So we're going to start trying to have him tie in what things trigger him or his somatic symptoms, what type of scenarios and triggers. Terry will learn how to challenge negative thoughts related to somatic symptoms, and that, like I said, that'll be after the therapeutic alliance and relationship is established. Terry will learn and practice thought-challenging skills such as thought stopping and cognitive restructuring 80% of the time. Once that is appropriate, the timing is appropriate. Terry will write down evidence that supports or disproves negative thoughts related to his physical symptoms 75% of the time. Terry will engage in pleasurable activities that do not involve a focus or determined, I think that's a typographical error, around somatic bodily symptoms. Terry will continue to attend weekly church services and interact with others in the church 75% of the time, perhaps grow a halo. Terry will research and enroll in a local cooking class within the 3-month treatment period. And there are some really kind of amusing scenes in the movie, one of which involves Bruce Willis's 2 daughters who were much younger when the movie came out, sitting around one of the kidnapped bank owners' tables. It was pretty funny. And let's see, Terry will reduce his anxiety related to chronic back pain and headaches. Terry will engage in moderate, enjoyable exercise 3 times a week. Terry will visit a holistic physician to become educated on alternative natural approaches to try to alleviate chronic pain. So I wanted him to maybe consider things other than opiates with the opiate epidemic. Sorry, it's time for bed. I work nights, so. And then Terry will engage in positive self-care by committing to therapy and treatment. And Terry will attend all scheduled individual and group therapy sessions and complete homework assigned. So we're going to engage Terry. We're going to make him an upstanding citizen of society and contributing to the well-being of his community along with his upstanding pretend brother. So I hope that wasn't incredibly boring. I hope it was kind of fun, and the movie is definitely fun if you're interested in seeing it, and I hope you have a wonderful final exam. I'm so looking forward to it. Take care.